Hi, this is Courtney Hungenberg, and this is my presentation on tuberculosis. I wasn't really aware that tuberculosis was still prevalent, even worldwide, until I found that my sister, who's a resident physician, one of the other girls in her residency program was just diagnosed with latent tuberculosis. So I really wanted to research it and find out how prevalent it is and just how she might have come across this disease. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. It's that rod-shaped bacillus bacteria. Its number one place to attack is the lungs. And it can stay in the lungs as a latent infection, or it can become active and start spreading to other areas of the body, like the kidneys, the spine, and the brain. And we'll kind of go over the difference between the latent and the active a little later in the show. So tuberculosis is spread through the air. An infected person, they have to somehow get that bacteria into the air. They have to either cough or talk or sing or sneeze or breathe, anything that has to do with expelling air out of the lungs. Tuberculosis isn't something that can be spread through a handshake. It's not something that can even be spread through kissing or sharing a toothbrush. Actual air carrying the bacteria has to come out of the lungs in order to infect the next person. And people with the latent form of TB can't spread it to others. There's no way they can spread it to others. They have to have the active form of TB in order to spread it to others. And there's a very specific reason for this that will come up later in the presentation. And it's kind of because in the latent form, the TB gets put into like this little pocket surrounded by macrophages. I'll go over that later on. But just know that tuberculosis has to be spread through the air. It can't be spread any other way. Some signs and symptoms of tuberculosis. Of course, there's going to be coughing. This cough will go on for weeks at a time. And so if you have a cough for multiple weeks over and over, a good idea of a culprit behind that would be tuberculosis. And so that's probably what they're going to check for if you go in with this persistent, horrible cough, especially if you're coughing up blood or sputum, that mucus that comes from the lungs, that sort of thing, spitting up blood, coughing up blood is called hemoptysis. You're going to have chest pain, coughing. With coughing comes chest pain, fever and chills, very tired, very weak, no appetite. People with tuberculosis will lose tens of pounds of weight just because they aren't eating. They have no appetite to eat, and they're going to have night sweats as well. TB infects the body in 4 different stages. In the first stage, these 4 different stages happen after inflammation has occurred. So in the first stage, the bacteria is going to travel to the alveoli, and macrophages are going to attack this bacteria. Sometimes the bacteria is too big to be engulfed by the macrophage, and sometimes the macrophage is not strong enough to destroy the bacteria. When that happens, the bacteria will reproduce inside. It will use the macrophage as a place to have a good environment to reproduce, and then it'll lyse the macrophage to spread it to other macrophages that aren't strong enough to decimate the bacteria. So during the second stage, the bacteria reproduces exponentially. For every 1 bacteria, you get 2, then you're going to have 4, 16. It's going to reproduce exponentially for 3 weeks until it spreads beyond control, and it can, at this point, either get under control in the 3rd stage, or it can lead to an active infection. But in the 3rd stage, the bacterial growth slows, and the healthy macrophages will surround the infection, and they'll form this sort of pocket of infection where the infected macrophages and the bacteria are inside. And this stops the spread. And at this point, most people go into the latent phase. So that bacteria is trapped there. It's not going to leave the body through coughing. It's not going to do anything. And that's why people with the latent stage of TB can't infect anyone else. But in the fourth stage, for about 5% of patients, and it could be 1 to 2 years, it could be decades even, that bacteria will start to reproduce again. And it'll start to reproduce quickly, and it'll spread out of that cavity, pushing and infecting those healthy macrophages that surrounded it, and it can cause the symptoms of the disease. So the coughing and everything will start after that. In the first to third stages, unless there's an active infection, there will be no symptoms. Here's just a little diagram that gives an idea of how those stages of the disease are happening. Tuberculosis is not something we really think about in the U.S. We have less than 10,000 cases in 2017, but throughout the world, it's very common. It's said that 1/4 of the population has at least latent tuberculosis of the entire world. And millions actually have tuberculosis disease, which is what active tuberculosis is called. The highest risk in a population is people with HIV, the elderly, drug users, just those people with immune compromised situations. It caused 1.3 million deaths worldwide in 2017, and it is the biggest killer of people with HIV. It's in every single country, every single state, it's everywhere. Because it's the biggest killer of people with HIV, here's this map that shows exactly how many deaths per 100,000 people there were in each country's population. And it's very high in sub-Saharan Africa, where there's numerous cases of HIV, but there's also numerous cases of tuberculosis. It creates like a really unique situation there where both are at play in very large amounts of the population. So diagnosing TB, there's 2 different tests. They're either going to inject dead tuberculosis cells underneath the skin and look for a reaction, which is usually a lump. That's a positive test. No reaction is negative test. Or they'll do a blood test where they collect blood, they put antigens in it. If your body's seen those antigens before, you'll produce interferon gamma. But neither of these positive results can say whether it's latent or it's tuberculosis disease, the active form. So if the positive result is found, they're going to need to do chest x-rays, they're going to need to do sputum testing to figure out if the disease is active or not, but typically someone would be showing symptoms at that point. So prevention of tuberculosis isn't something we really need to think about in the States unless you're a part of one of those high-risk groups. If you're a part of one of those high-risk groups, you really need to limit your exposure to people who have TB. Not that it can be the easiest to tell with the latent stage, but granted, the latent stage doesn't pass the disease on. World travelers really need to make sure that they are limiting their exposure to people with TB. If you're in a high-risk group and you do have latent TB, you need to get treatment right away. Treatment is going to prevent it from going into this active phase and potentially becoming fatal. The treatment consists of an antibiotic regimen from 6 to 9 months. They use multiple different antibiotics to treat it. They have to adjust that depending on if it has a strain of drug-resistant Mycobacterium tuberculosis, so it's very complicated. So this has been my presentation, and hopefully you've enjoyed it. Thank you.